Bismillahirrahmanirrahim. Assalamu alaikum. Good morning, everyone. We today we have lecture, and before the lecture, it is very important because the current situation to alarm and to know for everyone how to protect himself from the coronavirus, which is pandemic by WHO this time. I think it is very important for everyone, and this first slides is to reminder you just to keep in good hygiene, in washing your hand every time, gradual washing and repeated washing. Don't touch your eyes, mouth, nose, and prevent to contact with people who are ill. Try to use the mask if you need, and you have to get good hygiene food and playing gym or playing sport sometimes and sleep enoughly. You have to use tissue and just to get out as rapidly as possible. I think this is very important, and it is more maybe important for everything that can be done again. Return again to our lectures. Our lecture today will be attention deficit and information, attention and information processing, and this will be presented by Professor Dr. Muhammad Al Hadidi, Professor of Psychiatry of Mansoura University. Uh, Without attention, you can not gain any information because attention is the first step in gaining information for everything. So, attention is focusing consciousness towards certain stimuli in order to perceive. To be more clear, for example, if you see the figure or this see the figure, you can see this girl and present in her lap, and there is many information. But free doing this, for attention, I focus my consciousness only on the face to get much information about your face and don't see anything else, and that is attention. Why we have attention system? Because our brain has a limited capacity processor that which is selected should be constant with goals and expectation. We cannot catch all information get together at the same time. We need only some information to be catch it, and search this information sometimes is important and so on. So my brain is just focused on the information which is interesting for me and trying to get information in the best way, and so I focus on some information and disregard other information. Same like this image, a very nice image, but if we want to attend or to see the certain house only, I focus my attention for certain house again. So, element of attention. What is element of attention? First is selectivity of attention. It's giving advantage to one stimulus over another. As I say, if we have to focus on one certain stimulus and disregard other stimulus, this is called selectivity of attention. Alternation of attention or alterning attention. Attention usually shift from one stimuli to another stimulus. Dividing attention, it's okay, like we have attention and I divide it into two parts. It's like you are driving car and at the same time listening to radio of the car. In that time it's called dividing attention, doing two things at the same time are attended to both. Fluctuation of attention, it means that the attention is not the same quantity and quality all over the time. Sometimes it increase, sometimes it decrease. It depends on the interests, the weakness, and so on. Sustained attention, it means the ability to maintain constant behavioral response during constant, continuous, and repetitive activity. Focus on attention is the ability to respond and to pick out the important element of the figure of the attention from ground or background and external and internal stimuli. So I focus from different. See only the item I need and I disregard the background and so on. Try to do this with us now. We want you to find letter T. Yes, yes, it's here. Find letter T. Yes, it's here. Find the blue letter. Yes, correct. Find the blue letter. It's easy. Find letter vertical T. Vertical T. Okay. Vertical T. Yes. Find vertical T. Okay. Find vertical T. Yes, this is attention. Try to focus your attention. Find the blue L. Again, the blue L. Yes. In this slides, you want you try to use this. Say the color of the word, not what is written. The color, not what is written. For example, it's red, orange, green, so on. Yes, very nice. Again, say the color, not what it's written. Okay. Now, factor affecting selectivity of attention. Why I choose certain stimulus and disregard other stimulus. There is external factor or factors on the stimulus itself, and it could be intensity of the stimulus, the strong the stimulus you can perceive more or attend more, receive repetitive of the stimulus. Sometimes stimulus is repeated, and so you become attended to it. Changeability, change of size, change in color, change in anything. Contrast, it means that the difference between the stimulus and the background, if the background stimulus factor is clear, so it's more contrast, you can perceive better. Unfamiliar, so it means that unfamiliar, it means that if you found stimulus which this stimulus is not common for you, you try to use this to try to focus your attention for this stimulus. Combination of all the above stimulus or all of the above factors. Okay, combination of sensory stimuli, it means like using auditory and reading, vision, and so on. Two sensory organ can be affected more. For example, if you see stimulus which is blinking, it's different in light, and at the same time using sound. It's blinking with sound giving you more attention than just blinking alone. Internal factors. In internal factors, internal factors is the factor in the individual, and this includes either permanent factor or temporary factor. Permanent factor in the individual, in the person himself. For example, intelligence is a permanent factor, so people who is high intelligence is more liable to get information or attend information better. Also, the healthy organ like ear, eye, and so on. So hearing is an important part. If the patient cannot hear well, is a permanent factor that affect his attention. Habit. Some people has habit of perfectionism in attention. Known people that be excellent observers. These people has the ability to attend more and observe more. Other factor which is temporary factors. This temporary factor is a physical state. If the person is ill, he is less attentive. Emotional state, depressed person is less attentive than others. And a special set of preference, which is directing the attention towards certain stimuli like sound and colors. Factor responsible for alternating attention. Why sometimes I change the attention from one stimulus to other, from one stimulus to other. First factor is spontaneity. It is normal that attention is spontaneously to change from one stimulus to other because we cannot focus on attention on one stimulus forever. exploring. Sometimes you want to explore something, so you have interest to explore something which is not the main thing in the, for example, if you seeing, for example, the lecturer saying something, sometimes you want to explore which mobile he has, which watch he has, so your eye is shifting attention from what he say to his dress, for example, and so on. Monotony. Monotony is continuous same stimulus for long period and long time. This give an ease and monotony. It's, for example, if you see the sound of lecture for some lectures who speaking in one tone, not increase his tone, not changing tone. Sometimes he is sitting, he not moving, and it is very boring condition. And so you have to change his attention, or your attention is subconsciously changed from one object, which is him, into another object to do anything. Fatigue. Sometimes fatigue occur when people are going for lecture, for example, taking two, three lectures together, or one after one after one, and so in this time you feel the fatigue, and by time whatever the long period you are fatigued, and so you cannot give attention more. Satisfaction. If the person is knowing what is he is saying, and you get the most information of that one is going giving to you, for example, you become now at that time shifting attention from this condition to other. Satisfaction is inhibition of continuous of attention. Type of attention. Type of attention. First type is active attention. It means that you are doing some effort to maintain attention. You are doing some effort to maintain attention. For example, if I ask you to do digital subtraction from 100 subtract 7, try this with me now. 100 subtract 7. Right. Subtract more 7. Again more 7. Again more 7. At this time, you are subtraction, you are doing active attention. You're doing active attention because you focus your consciousness actively to do this subtraction, this active attention. In other part, we have passive attention. In passive attention, in this type, we are stimulating reach us to without directing our attention. You are going in street, you are doing something, and passively your attention is attentive to people going beside you, to cars, to streets, to something. You don't mainly focus your attention for this, but it occur without your making effort. This is called passive attention. Physiology of attention. Reticular activating system is the most important part for cortical arousal. Subcortical and limbic system structure is in regulating information to attend to parieto-occipital or posterior parietal loop system in focusing consciousness. And so frontal loop is directing attention from one source to another source. So frontal loop choose which stimulus I focus for this better. So attention is function of associative cortical area, and this could be evidenced through a lesion of prefrontal associated area result in distractibility, and lesion in parieto-occipitotemporal associative area result in perceptual irrelevance. It means that we have main area which is prefrontal area. This is choose the which stimulus I see, which stimulus I have to attend for. But we have area of parieto-occipital temporal, which is our associative area, and all this area gets information from cortical and subcortical limbic system structure that come from any sensory organ, from hearing, from vision, from any part, and this area are then stimulated and give you information for prefrontal area to choose which part I have to attend for or not. Disorder of attention. The one of the most important disorder, and this is very common disorder, is known attention deficit hyperactivity disorder. This attention deficit hyperactivity disorder is a mental disorder that most occur in children. It's about 6.4 million people in United States, and American children is about from age from 4 to 17 have been diagnosed with attention deficit hyperactivity disorder. The presentation of this attention deficit hyperactivity disorder is three types. First is an inattentive type. It is easily distractible. Child is easily distractible, unorganized, and difficult to listening. He cannot stop listening to you. He can usually distract you. He cut your information when you're discussing him. He always want to speak. Impulsivity or hyperactivity is he difficult to sit still. He cannot sit. He is rush task, very rapidly doing task, and he makes rush decision and impulsive decision. Both symptom together is called combination type. So people can be either, or children can be either inattentive type or hyperactive type, or can be both types. This is the most common and the most important disorder for attention. Now we have to go to second part of the lecture is memory. So we have the first part is attention and second part is memory and information processing. What is memory? Memory is the process by which information is encoded, stored, and retrieved. The component of memory system, sensory register, short-term memory, working memory, and long-term memory. Stages of memory. First, encoding, second, storage, and retrieval. What is meant encoding? It is if we can imagine the flash memory like this, how we use this flash memory. First, I have information put in any place. I change this information to be in certain digits, certain mechanism or certain codes. This can be stored in this flash memory. After that, I put this code in the flash memory and I stored it to be used again, and I can retrieve this information by changing the code again. So encoding is through elaborating or rehearsal something conscious. I stage memory, I encode, storage, and retrieving. How I encode through elaborating or rehearsal something I want to make put in the memory. Storage, I consolidation of the memory, so the memory learned part of material become part of molecular structure of the brain and tissue. Thus it's vulnerable to be less vulnerable to be forgotten, and retrieval its ability to recall this information from the store again. طيب, what is the factor affecting the storage? First, attention. If you don't do attention well, you cannot get information. As we say, it is the first part on the getting information. So attention should be the first and important one. We shall not remember anything unless we pay attention to it. Interest and motivation, and these are essential factors. So if you have interest to what you are studying, you will attend more and store more. Emotional factors like an anxiety lead to disturbance of retrieving information. Sometimes you are studying well, so you know everything, but in exam you are very anxious, so you cannot retrieve this information that you already studied, and this is not due to forgetting, but due to an anxiety. Learning by using more than more one sensory modality. If you study, for example, when you are studying you writing and sound at the same times, you have stored memory in one more than more modality. Sometimes people studying by seeing by eyes and speaking, and this make more information to be stored better. Global and more elaborated learning. If you study all things together, it is more that giving more interest and more learning and storage. Better organizing information. Rehearsal, it means the repetition of the what you are studying. It is a strong concentration helping storage. So repeat studying one and more. So this is making more storage. And repression, sometimes unconscious forgetting traumatic childhood experience, which is unconscious that can affect the storage of what information. After we attend to stimulus, what we need to respond is to react. So, information processing. We are now attend to stimulus, catch this stimulus for our memory. So, I process this information in my brain and so doing action. Information process. What is information processing? This is theory linked dealing information in the human brain with computer, where there is input unit, processing unit, and output unit. So it is certain method or certain theory trying to understand what the brain do, like the computer, by using the computer. However, in processing does not really occur in unidirection in human, it is bidirection. How can we say? It will be seen in the next slides. For example, in computer, we have input unit. It is the unit you use to introduce information to the computer. Then processing, center processing unit is the part that processes the information you entered, and later this information or the result of information can be cached in output unit, which may be monitor, maybe printer, and so on. In, for example, in computer, we have mouse, keyboard, scanner, joystick, and webcam. All these may be called as input units. This memory, this signs or stimulus will be processed in the central processing unit, which include RAM or hard disk and so on. All this information is processed in this, and later, as a result, we get the result of what we want to know, and it will be presented in monitor or pointer or speaker, and this is called output unit. In brain, we have sensory memory, which represent as input unit, and central processing unit or central executive part of the brain, which is called working memory, and long-term memory, which is the output part of the brain. But in the brain, the direction is more bi-direction. It means that sensory, by the information in sensory memory, I can get it to working memory through attention. Also, if we want to do something in working memory and I want to attend certain stimulus, I can attend to it, so I can get information from sensory part by from working memory. It's bidirectional. Also, sometimes in working memory, if I have to do learning time and time, I will transfer information from working memory to long-term memory, which is through learning. And by time, the information is the learning or the long-term memory, the learned information. If I want to get it out, I can use through the retrieving information from working memory. It's bi-directional relation and will be studied later in the next slides. First, first type of, so we have three types of memory that can do in information processing. First is sensory registrar or sensory memory. This each sensory system has its own sensory store, which receive and hold all external and internal stimuli. It's very brief. It take about 1 to 3 seconds, and the sensory stores hold it into the sensory information till unconscious process operate of these tracks and to determine whether input should be brought into the working memory or to be cancelled. So if the information is important in this sensory memory, it will be passed to the next step, which is working memory. But if the information is not important, it will be cancelled and disregarded, and that's why we use this memory to choose which important or not. It has two types of sensory memory. Icon means image. So information in this sensory system could be stored as image for the small duration, or echoic. Echo means sound. So this may be stored into sound. So we have either sound or image, iconic or echoic memory. Sensory memory can be has a large capacity. It take all the stimulus beside you, all thing around you, and so it is large capacity. It can take everything, but it cannot be passed to short-term memory except if you attend to this. Where you are sitting now, once you are sitting now, you can see the lecture, you hearing my voice. At the same times, you have to see or to hear some sound behind you and doing everything. You can see the light of your room and so on. All these are stimuli, but you attend only, for example, for the lecture, so you catch the information from the lecture due to your attention. But in fact, you get many information at this time, and all this information can be disregarded because you are attend only for the lecture. Second part is the content. All sensory stimulus, whether from external or internal, should be inside this content. As I say, it is very huge and it contain all information for this. Duration is 1 to 3 seconds and a type will either be iconic or echoic. It can be received from this through from long-term memory through the attention. So you have to make attention. So this attention is directed by working memory. Working memory or short-term memory is the second type of the memory we already having. Working memory is believed to be a center processing unit of our brain or center conscious, which is analog. The computer, it is like the center processing of computer where information from long-term memory and from environment from sensory memory are combined together to solve a problem. So I get information from long-term memory about my experience, about what I learned before, and get information from short-term from the sensory store memory, and both information together give me information will be processed in what is called working memory, and so give me solving a problem. However, the working memory has a small capacity so that it is not be able to attend too much to information and time, thereby limiting the ability of the human to solve the problem. Because we cannot catch all information, so we need only some information according this, because our brain it has not so much capacity. So he choose only the important part, the information I can get. Working memory, which is information processing part of the memory, as we say, catch information from sensory memory, which is just discussed before, which sensory information and stimuli, and long-term memory, which is previously known or experience or previous situation I already get from long-term memory. I process both information to get at the last what is called working memory. This working memory contain image and sound. Duration is much longer than sensory memory, which is about 5 to 20 seconds. Capacity is limited 5 to 9 separate items, 9 chunks, and parts. It three has 3 parts. One part is phonological, which is words. It's contain handles of word, visual spatial, which contain image, and central axis, center executive part, which is focusing attention to set the goals. So we have information from sensory memory passing to working memory. We have 3 parts is phonological, so it contain word, visual spatial image, center processing units, which catch the information post together. And lastly, it give again to long-term or retrieving memory. Working memory and long-term memory. In working memory, information in working memory to be put in long-term memory, we want to use learning. So learning is the method by which I get the information from my working memory, which is central processing memory, to long-term memory, so I can use later as an experience or something. How I learn? To learn, we have to be repeated by rehearsal. Rehearsal means repetition. Either maintained rehearsal, so I repeat time by time, or elaborative rehearsal is connecting this information with the already I know or what I already learned before. So sometimes I repeat information, repeated again and again and again, so I learn. Or sometimes I link the new information by with the old learned information, so it is easy to be rehearsal again. Long-term memory, which is the store, it's your brain, its output unit. It is long-term memory can store large quantity of information and potentially unlimited duration. Sometimes a whole life can be stored in your this. All thing you can put, it is your hard disk. It is part of you can store all what you learned since birth till now, and it is long-term memory, and it is divided into declarative or explicit and procedure, which is implicit memory. Procedure and declarative memory. So long-term memory, we have two, declarative and procedure memory. Declarative, what you know, it based on the conscious recall of information, and procedure, knowing how. So here what and here how. For declarative, what you have experienced or about certain time, it is called episodic. If I ask for your memory about certain time and certain place and certain situation, what is your date of birth and so on, it is called episodic memory. But if we search for information which is fact, you already learned it, it's fact, it's not related to your life, for example, not episodic, not time related, it's called semantic. What is we learn and not related to your life. For example, what is the capital of Egypt? What is the capital of Egypt? Cairo. It is information. This information is not related to your life, and it is also, as we say, what you know, and what we know is put in declarative. On the other hand, the procedural memory, how we know or how we know something. For example, first is procedure memory. This imply in learning motor skills and habits. Learning motor skills is in how. How we know it's procedure memory, and it depends on cerebellum and basal ganglia. Priming is facilitating of identification of perceived object as a consequence of specific period exposure to this object. It means that if I already know the object and I see the object again, I identify this, I know this, I remember this. For example, if you see a certain car, this car of Muhammad, and later by time when you came again to see a certain place and you see this car again, you know this is car of Muhammad. How you can know this? Because you already learn it and stored in your part of the brain, and now you're making identification. I remember this mem. It's called priming. Simple conditioning is the third part for procedural memory, and this third part in which acquisition of new conditioned response, which may be either emotional or skeletal. It means that conditioning is combination of two stimulus together. For example, when you smell a good taste, smell a good odor of food, it usually means that you eat a very delicious food. So smelling now is combined with a taste of good odor of good food. So condition, you learned that smelling of good odor of food, it mean usually combined with a good taste of food. Physiology of memory. Memory are attributed to change in the neural synapse. So everything you learn, it will be changed in the neural synapse, which is junction between the neural nerve ending together. So what you learn change your brain. So brain now is changed structurally, and this neural synapse usually change in hippocampus, which is receiving the input from different part of cerebral cortex, where it is processed and then it send it out to different part of the brain. And So the brain area involved in memory is hippocampus, which is the important memory consolidation part through learning memory and declarative memory and explicit memory. All this memory will be stored in hippocampus. Amygdala is the part of the brain responsible for emotional memory, memory of love, memory of anger, memory of fear, will be stored in this amygdala. Any situation associated with fear, love, something is stored in amygdala. Other area is striatum or mammary body can be affected also. So hippocampus and amygdala damage can cause memory loss with problems in memory storage. So the main part in the storage of our memory is hippocampus that consolidate memory and put all types of long-term memory to it. And amygdala is for emotional memory. Why we forget? We forget usually not because the memory is get out, no, because it is a long-term storage memory, but we lost the access for this information rather than to loss of the information itself. Why? Sometimes because we decay it's mean not using this memory. Any information you already learned it before but you don't use, sometimes you forget this. If you forget, not because it is not present in your brain, as we say, it is already stored, changed in the brain, but you lose the access for this because the pathway to get this information you don't use for large much time, so it will be lost. Interference, sometimes when you get a new information, that this new information not or interfere with the old one, it means that I get the new information to delete the old information, and that's why you forget the old learned information. Disorder of memory, we have two main disorder of memory. If the memory will be changed or lost before 18 years old, it usually mental retardation in these people with handicapped mental retardation have difficulty in memory storage and they cannot learn easy, and so they cannot catch information very good and have no information processing, which is mental retardation. On the other hand, after the age of 18, and usually in very old age, like 60 or more, we have what's called dementia. And in dementia, which is different type, which is sometimes with vascular Alzheimer disease and so on, but all of them are characterized by memory impairment, perceptual disorder, sometimes attention disorder, concentration, language and judgment and thinking. All this information can be affected and it could be considered as disorder of memory, and it is very common with old age. Now it is the end of our presentation today, and thank you for your attention for the lecture. Thank you.